Thank you. Which was some material about Ireland's proposed alcohol health warning labels and the arguments that are being made at the World Trade Organisation about Ireland's proposal. So just before I go further, I'd like to acknowledge the traditional owners of the land, the Turrbal and Yagara people, and pay my respects to their elders past, present and emerging. So what I'll cover today is a little bit of information about Ireland's proposed alcohol health warning labels and how these are different to what's been proposed for other countries, the alcohol industry's opposition to alcohol labelling. For those of you who don't know very much about the World Trade Organisation and its Technical Barriers to Trade Committee, I'll introduce that to you and discuss the arguments that have been made in the Technical Barriers to Trade Committee meetings about health warning labels on alcohol containers, and then particularly what types of concerns have been raised at the TBT committee about Ireland's proposal. And I'll briefly evaluate the arguments that have been made and present some counterbalancing arguments. So in 2018, Ireland introduced legislation that contained a range of measures to regulate alcohol policy. So there were things like minimum pricing for alcohol products, the prohibition of alcohol advertising in certain places, and some rules around alcohol sponsorship, and also a range of information, health information to be displayed on alcohol products. So this included warnings of the direct link between alcohol and fatal cancers. And you can see what the warnings will look like on the screen there. So there was no immediate action on warning labels back in 2018, but in 2022, the Minister for Health began the process of developing the regulations to implement the warning labels. So the regulations set out the text, the size, the colours and formatting that would be included on the labels, including this wording around liver disease and the link between alcohol and fatal cancers. And the warnings will apply to all alcohol products sold in Ireland and including imported products, but the label can be applied either at the time of manufacture of the product or via a sticker that's applied before it's sold in the stores. And that fact that it can be applied via a sticker is something that I'll come back to a bit later in the presentation. So alcohol's proposed health warnings are world leading, although there have been some initiatives to try and warn consumers about the risks of cancer via the alcohol product packaging. Ireland's health warnings go a step further. So South Korea does have mandatory health warnings for alcohol products, but suppliers can make a choice between 3 different labels, only 2 of which actually mention cancer. So they can choose a label that doesn't mention cancer to put on the container. The Yukon government in Canada did a trial in 2017 to 2018 of large health warnings for alcohol containers in multiple colours, and there were a range of different warnings that were rotated, and they were in both English and French. But that trial was brought to a halt because of pressure and legal threats by the alcohol industry. So they didn't proceed with it beyond 2018. So although there have been these initiatives, Ireland will be the first Anglophone country to require cancer warnings on all alcohol products that are sold in the country. So just to compare that with what we have in Australia at the moment. So Australia requires from July 2023 pregnancy warnings to be displayed on alcohol products with this, and you can see the warning that's required to be placed on alcohol products there. Before that, we had a voluntary scheme run by Drinkwise Australia, an alcohol industry organisation that didn't have very good uptake and consumers, the research into that scheme showed that consumers didn't have a good understanding of the risks associated with alcohol consumption because of that warning. We also in Australia have standard drinks information that's required to be displayed, and the percentage of alcohol by volume, but no cancer warnings at the moment. So the alcohol industry has strongly opposed any alcohol labelling initiatives that warn consumers about the risks associated with alcohol consumption. And this is so both in Australia and globally. So the label is a very important promotional space for industry. And in fact, the industry often refers to the label as its real estate. So it's really important for, conveying those messages to the consumer about the, the product, the pictures of the winery or the embossed logos and things like that are very important to industry in the same way that they were in the past to the tobacco industry. And the industry really opposes any labelling that might undercut the messages that they want to convey to the consumer, and that exposes it to more government regulation. So we see a lot of national opposition and also industry trying to intervene at the international level to sort of prevent the global diffusion of labelling initiatives in the same way that we heard from Matthew earlier about the way the tobacco industry has used sort of international law to try and prevent the global diffusion of tobacco plain packaging. So South Korea's alcohol labelling regulations were discussed at the World Trade Organization, and we're now seeing discussion at the World Trade Organization of Ireland's measures. So for those, I know some of you in the room will know a lot about the World Trade Organization and its Technical Barriers to Trade Committee, but some of you might not know a lot about it. So bear with me for a minute while I go through a little bit of background. So the World Trade Organization is a global institution that includes a set of agreements that have rules that seek to try and eliminate barriers to international trade. And as well as these 29 agreements, multilateral trade agreements, it also includes processes for countries to raise concerns either informally or formally about the perceived non-compliance of other WTO members with the rules in those agreements. And the WTO rules, although they're not designed for the purpose of serving industry interests, they can end up serving industry interests where industry tries to use the rules to stall policy progress, or where the rules are cited by state representatives in WTO discussions in a way that benefits the industry. And sometimes states delay, modify, or abandon policies because they worry about these challenges and try to prevent escalation of these debates to formal disputes under the World Trade Organization. And Matthew talked a little bit about that this morning in relation to tobacco. So the Technical Barriers to Trade, or TBT agreement, which I'll use to refer to it, is one of those 29 agreements at the WTO. And the Technical Barriers to Trade agreement prohibits unnecessary obstacles to international trade created by domestic technical regulations and standards. So health warnings falls into that area of technical regulations and standards. So health warnings on a variety of products are frequent matters for discussion at the committee meetings for the Technical Barriers to Trade Committee. So the TBT committee meets formally 3 times a year, and the most recent discussion was in early November. And it's a forum for member states to discuss proposed technical regulations and standards. So if a country like Australia, for example, wants to introduce a new technical regulation like our pregnancy health warning labels for alcohol products, they need to notify the WTO, and then other countries can raise queries or arguments about that proposal at the TBT committee. So we often see countries raising concerns which might be framed in terms of requesting information or querying a particular policy's consistency with the TBT rules, particularly the idea of whether the proposed measure presents an unnecessary obstacle to international trade. And if these concerns aren't resolved at the TBT committee, so often countries will go back and reconsider their proposal, they might change some aspects of it, or they might delay its implementation. If that doesn't happen, these concerns can be escalated to a formal dispute in the way that Australia's proposed tobacco plain packaging rules were the matter for a formal dispute. So together with colleagues, including Pepita Barlow from the London School of Economics and Political Science, and with Paula O'Brien, we did a study of the discussions at the TBT committee about alcohol health warnings over a 20-year period. And we found that, so we looked at the minutes of those meetings, and we coded them using a taxonomy of alcohol industry arguments that were made in national policy forums. And we found that over 55% of the statements by the WTO member states reflected the industry arguments that were made about health warning labels at the national level. But only 3.3%, in only 3.3% of these statements, WTO members actually acknowledged that the claims represented industry. So, and we know that the TBT committee discussions have had an impact on whether countries have proceeded with some of their alcohol health warning labelling proposals. So Thailand had planned to proceed with graphic health warning labels in 2010. And a lot of countries argued against that, and Thailand, including Australia, and Thailand didn't actually proceed with the graphic health warnings. We can't draw a causal relationship necessarily between the TBT committee discussions and Thailand's decision not to go ahead, but it was a factor in Thailand's decision. So Ireland's new cancer warning labels are being queried in the WTO by a number of different countries, including Australia and New Zealand. So Australia and New Zealand are not the main ones putting these arguments forward. It's led by the US, Mexico, and the Dominican Republic, but Australia is supporting those arguments and raising queries and concerns. So the types of concerns that are being raised in the TBT committee, there are several of them. So members often start their comments about Ireland's proposals saying that they support Ireland's desire to communicate the health risks of alcohol to the community. But they go on to make these arguments like the Irish label restricts international trade. It's a burden for exporters who want to sell their products in Ireland. It creates additional costs and administrative complexity because the alcohol suppliers need to put this specific label on their products before they can export them to Ireland. They also argue that it's not accurate, it lacks scientific backing, and that it's not even consistent with the EU law, and because the EU law tries to create a single harmonised market, it tries to have the same requirements for products that are sold. And we also often hear countries arguing in these contexts that there are better options for communicating with consumers. So instead of having health warning labels, we should have public and schools education, or we should have QR codes put on the products so that consumers can just look up the information on the internet. So in reply, the EU, which represents Ireland in the TBT committee discussions, is saying that, well, the label was designed to provide consumers with straightforward information on the risks associated with alcohol. And although there's an impact on trade, it's been designed in a way that minimises that impact. So it allows the supplier to put the label information on via a sticker after the product's been exported, but before the product's sale. So it doesn't mean that the wineries have to run a completely different product run with the label specific to Ireland's market. They can just simply put a sticker on when it arrives in Ireland. There's also a 3-year transition period. And in terms of the argument about the EU harmonised market, the EU is actually working on revising its regulations around food regulation, including alcohol labelling. So it may well move in the direction of Ireland's proposal anyway. So in terms of how strong the arguments are that are being made against Ireland's proposal, I think first of all, it's important to acknowledge that there is a burden on trade, not necessarily as significant a burden as what the other countries are claiming. It's not as costly or as complex as is often claimed. The industry often overestimates the costs associated with changing its labelling, and putting a sticker on after export is not something that's terribly costly or complex. Many different countries already have different labelling requirements, including countries in the EU. So the industry's arguments that this is kind of an exceptional measure don't really stack up. And in fact, Australia has our pregnancy warning labels, so we already require exporters from other countries to comply with our labelling requirements. There's a 3-year transition period, which is really very generous. And although, the Australian wine industry is asking the Australian government to object to Ireland's proposal, actually, Ireland is a very small market for Australian wine. So only 30% of our exports go to Europe, and only 2.3% of that 30% actually go to Ireland. And while the Irish labels do mean that there are different requirements for different EU countries, the EU Commission didn't object to Ireland's proposal. And as I mentioned before, it's currently working on alcohol labelling regulation anyway. So one of the arguments that's being made is that the label's inaccurate and doesn't have objective scientific backing, but actually there's very good epidemiological evidence about alcohol and cancer. Alcohol is a class 1 carcinogen, responsible for 4% of cancer deaths globally. There's a dose response, a dose response relationship. So even low levels of alcohol consumption are associated with an increased risk of cancer. We know that public understanding of the risks is low, both in Ireland and Australia and in other countries. And we also know that labelling works. It's been recommended by the WHO. There's evidence of effectiveness of the label as a way to provide information. And there's some evidence of effectiveness in terms of changing people's behaviours around alcohol consumption. Countries often argue that education campaigns are a good alternative, but actually they don't offer a better way to inform consumers about risks. If they're implemented in concert with other initiatives like labels, they can be more effective, but on their own as an alternative, they're not effective. And QR codes are particularly ineffective. So a study looking at the usage rates of QR codes found that they were very ineffective in conveying the information to the consumer. And it's interesting that, industry and these countries that are objecting to Ireland's labels aren't suggesting the WHO's best buy policies as alternatives, like things like taxes, reducing availability, or restricting advertising. They're proposing these ineffective policy measures instead. So just in conclusion, the successful introduction of Ireland's groundbreaking cancer warning labels is really important. It's important not just for Ireland, but for other countries including Australia. The alcohol policy NGOs in Australia would like to see Australia moving in this direction. So we need to not just ensure that Australia doesn't derail Ireland's proposal at the WTO, but also that we keep that policy space open for Australia and other countries to move into. The industry is fighting it hard, both in Ireland, in other countries. You know, the alcohol industry is making representations to the Australian government about what it should be saying at the WTO. They are also, you know, trying to influence other WTO representatives in terms of these arguments. The TBT committee is an important forum for debate, and the industry has its eye on what's going on here. But the arguments that are being made against Ireland's proposal are actually not very strong, and they can be counteracted. So part of what Paula and I have been doing has been talking to alcohol industry NGOs about what types of arguments they can be making to the Australian government in relation to this issue.